Webinar is going to last about an hour. We are going to have plenty of time at the end for questions and answers. So as we'll get to in a little bit, we'll give you instructions on how to enter questions, and we'll answer them kind of as we go. So just to give everyone a little background on us, Earthbound Media Group is an interactive marketing agency based in Southern California. And we specialize in serving the healthcare industry with many different services, including expert consultation and implementation for website design, digital marketing, and social media marketing. Presenting for you today is Jessica Liu, who is a search and display advertising professional here at EMG. Jessica has worked with some of our most influential healthcare clients, including Loma Linda University Medical Center and St. Helena Hospital. Jessica specializes in lead generation, customer retention, and social media content strategy. Co-presenting with Jessica today is Isaiah Jones, who is an account manager with Google. And Isaiah is going to be providing some insight onto how to use Google AdWords, kind of its functionality, and how to optimize your accounts and make them work for you. And Isaiah specializes in research and strategy for healthcare clients of many different backgrounds, including hospitals, cosmetic surgery centers, and family planning services. So before I turn it over to Jessica and Isaiah, just want to remind everyone that we do want you to ask as many questions as possible, and you're going to do that by just inputting them into the dialog box that should be up on your screen with the presentation. We're going to do our best to answer questions as they come through, but we've also set some time aside at the end to address anything that we don't get to in the presentation. And just as a reminder, this entire presentation will be available on the EMG website later this afternoon, so you'll be able to watch it again and again. And the slides will also be available for download on our SlideShare page. So with that, it is my pleasure to turn the conversation over to Jessica and Isaiah to get things started.
Thank you, Zach, and hi everybody who's listening in. So to get started, today's learning objectives. From this webinar, you'll gain a better understanding of the types of information health consumers are searching for online, the key benefits of partnering with Google and a digital agency to really target and engage your health consumers, and also lead generation best practices to optimize your website for higher conversions. And to quickly go through the agenda, just to introduce you to what we'll be talking about today, we'll be starting off with introducing the healthcare search landscape, where we'll be sharing industry numbers and key demographic insights on health consumers, and giving valuable data on the types of health and wellness information that's being searched for online today, and an overview of lead generation to help our audience get more familiar with online lead generation and how a patient acquisition funnel might look like, and advertising on Google using AdWords, where Isaiah will share important search trends for hospitals and health centers alike to learn how to use Google AdWords for search and display marketing, and lead generation best practices, where we'll be sharing 6 important tips to really execute a successful lead generation campaign. And EMG's case study, we'll share a special case study on one of our healthcare clients that's doing lead generation right now and has seen really great results. And finally, we selected one of our lucky attendees' websites to provide feedback on how to optimize it for lead generation. So that's going to happen at the end, following Q&A, and followed by Q&A. So to get started, we wanted to better understand our audience and take a quick poll on to see what everyone's doing right now in the search space, whether or not you've gotten started or maybe you haven't gotten started, and understanding what some of your challenges are. So we're going to initiate a poll right now, and go ahead and take a few seconds to look over the answers and really select what are you currently using paid search to do, and whether or not it takes a part of your budget. And these answers will really give us some insight on how we'll introduce search in this presentation. Okay, and the answers are coming in, so we'll give a few more seconds here. Okay. So we're going to share the poll results right now. See. So we see here that majority, let's see, 46% of people are not using search marketing right now to drive leads, and also evenly, there's a small percent of 46% of people are using only a small percentage of their online budget to drive leads online. So it's great to know that people are aware of search, but it seems like right now most of you have not started, and hopefully this webinar will give you some ideas on how to get started. So let's take another another poll right now to really understand what some of your challenges are with online lead generation and why maybe you guys haven't gotten started yet. So what is your biggest challenge with online lead generation? Perhaps some of you don't know how online lead generation works, or maybe you're not sure how to reach your target audience, or maybe there's been a low conversion from lead to patient. And hopefully we'll be able to answer some of these challenges for you today. Okay, we're waiting for some of these last answers to come in. Okay, just a few more seconds here. All right, great. Oh, there's a few more coming in. All right, so closing the polls now. I do want to share these results just to see how how our audience is really what kind of biggest challenges they're seeing with online lead generation. So we see that it's actually spread across, interestingly enough, evenly. Majority of people is unsure of how to reach their target audience online, and really 33% across the other three answers, people don't know how lead generation works, and perhaps there's a low conversion rate, and I'm really not sure how to measure success on your online lead generation campaigns. Okay. So that's great feedback for all of us to really understand, to kind of set the ground for going through our presentation now and hopefully address some of these challenges. So to answer the question of how to really, how to reach your target audience online, we want to introduce how the health search landscape looks like right now. So to get started, I'm sure many of you here today because you know or suspect that many of your clients or patients are going online, or maybe we should say Googling you first before they make an appointment or schedule a consultation. And statistics do show that Americans are spending more time online year after year to find health information. And a recent study showed that in 2010, 169 million U.S. adults, and that's 72% of U.S. adults, are going online for health information compared to 99 million in 2005 and 63 million in 2002. And in another study by Pew Internet, 8 in 10 Internet users have looked online for health information. And many e-patients say that Internet has had a significant impact on the way they care for themselves or for others. So moreover, finding health information online is now the third most popular activity following email and search. For those of you who attended our last webinar, we're sharing again this exact same slide because it's important to note that finding health information was, oops, sorry, let me go back here, was once, sorry about that, I'm not sure why I went over here, okay. Okay, sorry about that technical difficulties here, but this is a slide that I wanted to cover. So we see from this graph here that most people who are searching for online information, that was once an activity that was primary for the primary domain for older adults. It's now the third most popular online activity for all internet users 18 and over, and that's 80 to 89% across 4 generational age groups if you're looking at this graph right here. And also, if we take a look at even the 74 plus, the older demographic, there's 50 to 59% of people age in this age group also finding health information online. And I know you guys got a preview of the slide, but when we look at the types of health information that's being searched for online, we show that symptoms, treatment, diseases, and conditions are our top 3 categories, with 60% of the U.S. internet users searching for general symptoms, followed closely by 58% searching for treatment options, and over 55% searching for specific diseases and conditions. Wellness and drugs and medications are also well above 40% of searches. And based on that data sample, research also showed demographic differences on health-related searching activity. For example, women are significantly more likely than men to search online for information about symptoms, treatment regimens, diseases and conditions, and drugs and medications. And men are actually more likely than women to conduct topical searches about vitamins and supplements, health insurance providers, and doctors. And searches for wellness-related topics are evenly split across between men and women. And the younger audiences, the 18 to 34-year-olds, they're more likely than the average, more likely than older adults to search for information about symptoms online. But they're less likely than average to search for topics around diseases and conditions. And this largely has to do with their age group. So for adults over the age of 45, they tend to be more focused on searching for that disease-related information. And wellness is a topic that appeals predominantly to the younger demographic, with 62% of 18 to 24-year-olds looking for information about topics such as nutrition, exercise, and weight loss. And when we look at what's driving people online, we find that 75% of healthcare searchers have been prompted to go online to investigate symptoms or conditions, while 41% go online to self-diagnose or treat a condition. Again, there's a small percentage of people going online to fill prescriptions or just to find out more about medical procedure and managing their health records. But this percentage is certainly going to grow in the next couple of years as more and more people go online. So we see that older consumers, especially those over the age of 55, they're considerably more likely than the younger adults to conduct that type of research online. And this may not come as a big surprise, considering most of us really use search engines to look for any type of information, but we do see that 70% of online adults have used search engines to search for health-related information. That's really the first point of contact where people go online and they don't know your website, they try to Google it or go on Yahoo or MSN to search for that information. And 46% have navigated to health portals such as WebMD. And also we see an increasing, growing majority are using social media as a channel to obtain health information. Now, we also wanted to give everyone some demographic insights on baby boomers, a target market that's probably very relevant to many healthcare providers, because in 2010, the study showed that there's an estimated 56 million boomers that are online. And even more impressive, they spend about 91 billion minutes online each month. And that number really makes them the largest online group. And this is important because we see that, in fact, 57% of boomers have searched online for health information, and 71% of boomers use the internet to make purchase decisions. And this last statistic is an important one to keep in mind as we talk more about the importance of call to actions on your web page to ensure visitors who land on your page have a clear sense of what to do next. And more demographic insights. mothers are online. So those of you familiar with the blog space and our daily blog readers like myself will notice in the past few years the increase of mommy blogs online. The search in mommy blogs and mommy interested content really comes from the moms that go online daily, with more than 50% going online more than 20 times a week. And moms spend about 3 to 10 hours a week reading mommy blogs. And how this is relevant for the health industry is that 84% of moms say that the internet has made them more informed about children's health issues. This is an important fact for the children's hospitals out there. And with all the moms online, 69% of moms have said that they trust their pediatrician but still go online before and after their doctor's visits to conduct their own research. And again, 69% of moms, they research health, medical information, and advice online on a regular basis. So this really goes to show that moms and people in this day and age alike are just more interested in finding more information online after visiting a doctor or learning more about a medical procedure, etc. Now, that was a lot of stats and trends to remember, but don't worry, these slides will be available for your download after the presentation, so you don't have to take down all those percentage numbers. But we do want to hone in on the benefits of understanding health trends online. And that's because understanding health user search behavior really informs a lot of strategy and best practices we'll be covering in a bit, including keyword targeting and making sure your business or institution is visible online based on what people are searching for. So here we have an example of more general search terms such as cancer treatment, and that has a higher search volume than, say, a more specific search term such as pancreatic cancer treatment. And this doesn't mean that you should go for the general keyword because that might not be relevant to your target audience, and you also want to be more specific with what people are looking for. And also sometimes the general keywords may be more expensive. So number 2 here is we want to make sure that your keywords appear in your ads. The ad messaging will be really important to keep that relevance. And also, same thing for your website content. Once people find you on a search engine and find your ad, they land on your website, and you want to make sure your content is really relevant to what they're searching for. Otherwise, you might see something like a high exit rate after landing on your site because it's not what they were looking for. And this is the most important point, I think, for many of you, is really making sure that your research informs your conversion and results. And that really comes from constant optimization and testing and making sure that you're looking at the right metrics. That way it can really help you make more informed decisions on where to put your marketing dollars. Now that we've given you lots of industry trends, we want to share an overview of lead generation for those who may be more familiar with traditional lead generation, but not so much how online lead generation works. We wanted to kind of have these two comparisons so you understand the types of marketing that goes into both. So for traditional lead generation, I'm sure all of you are more familiar with traditional advertising such as print, radio, TV, outdoor, direct mail, cold calling, field marketing such as conferences and events. But really now there's more of a shift from offline to online, or people are really doing both. So with online lead generation, we have search engine marketing, and that includes paid search and SEO, which is search engine optimization. We also have display banner advertising, meaning those image ads that you see on many of those websites. Sometimes they even follow you around. And also email marketing, mobile marketing, and social media marketing. So the mobile and social media is really a segment that's really growing in the past year. And all this information, once you're reaching your audiences in these channels, you're ideally driving them online to a website, landing page, or microsite, and allowing them to do a little more research and understand your institution, your business, and your service offerings better. And again, with traditional print, radio, and TV media properties, they can still offer a great deal of opportunities to drive leads. The digital or online lead generation really offers new opportunities for you to connect your audience offline, online, making sure that they once they receive your print material, that they're able to find a corresponding web address for them to go online and read more, find more information. So digital marketing has many components, and while we're focusing on search and display advertising today, we want to illustrate the full set of online marketing solutions that can go into your digital marketing mix. So each of these will serve a different purpose, whether it's to get more leads with search engine marketing, to generate awareness, maybe that's more display marketing, or to build a community with social media, mobile, etc. And the ideal mix is really having every component of your marketing working together. Now, making a case for focusing more on online lead generation, and I see that many of you haven't gotten started yet, research has shown that with traditional lead generation alone, more than 50% of the leads that you generate could end up buying from one of your competitors. So 50% is really an alarming percentage. So, we're wondering, where do these leads go? Well, based off of the previous statistics presented, they really go search online. So more individuals are conducting research online before and after the doctor visits, and your competition is likely just a click or two away. How many times maybe have you Googled your hospital, your medical center, and you go online and see a competitor ad come up? So the solution here is making sure that you're equipped with the right resources and detailed information that's relevant to your leads on your website and landing page. So traditional marketing, definitely don't eliminate that. I think there should definitely still be a budget allocated towards it, but it can really generate awareness. But once your leads find other materials, including your competitor sites online, there is that missed chance that they may go to your competitors. So the opportunity here is really to engage your leads online, making sure there's a full process that follows through. And here we have an example of EMG's acquisition funnel. So for those who may have seen something similar to this, identifying what part of the funnel you want to target will be important to really choosing the right mix of your marketing solution. So looking here, we see that many people, while they're searching, this is the awareness part where display ads, those image ads, and your text ads will really come into use. And in that consideration phase, that's when they're maybe searching more about medical conditions, the costs associated with it, whether or not you guys take insurance. That part is the second part of this funnel. And then going into the part, this is the conversion area, where patient enrollment is the key call to action here. So making an appointment or contact us now, having that message on your website will be extremely important. And this retention portion is really that part where you make sure people come back to your services, or maybe even give referrals. So this is a spectrum of, your digital marketing mix, things that you can do to really target each part of that funnel. And today we're focusing on the paid digital aspect. So what part is really makes sense for you to allocate more of your dollars to, if you wanted to educate people during that awareness portion, or provide more details during that consideration phase, and really using all these together to make sure your lead generation process is flawless. And this is an overview of our lead acquisition process. So many of you may have seen a similar graphic illustrations, but keep in mind that the flow here traditionally is from the brand to the customer. But for here we have this customer searching first. So in that awareness phase, people are searching for your business online, and during that consideration phase, and that's where you want to reach them, during awareness and consideration, because that time is where they're comparing websites. They're comparing your business to someone else's business and really asking a lot of questions. So you want to make sure that your website perhaps has a form or a phone number that they can reach out to really answer those questions, and that will help them make that ultimate purchase decision, or that final decision to enroll. Okay, and now it is my pleasure to introduce our partner, Isaiah, who will be going over more details about Google AdWords and their many advertising features.
Thank you, Jessica, for covering all that information. Hey, everybody, my name is Isaiah, and I work here at Google, and I wanted to just take a little bit of time to go over a little bit of the benefits of Google AdWords and talk to you a little bit about some of the features that you may find useful in terms of generating a successful lead gen campaign. So first, I wanted to go back through and revisit a couple of the statistics that Justice had mentioned earlier. But one thing that many advertisers are unaware of is the large market that exists online. Consumers are not only just looking online for, going online to purchase products or, using it for travel information or anything whatnot, but what they really are doing online is looking for health-related information. In fact, 41% of those that are online are seeking healthcare information use the internet as their first source of information, even before they contact their doctors or friends and relatives, which is pretty powerful. And when they're online looking for this information, they actually use hospital sites and search engines like Google to find this information. So this is pretty powerful information when you're thinking about where people are going online and what type of market there is out there. People are looking on sites like many of you have, and they're looking on Google for this information, and there definitely is a strong and growing market out there. Next, I wanted to talk to you a little bit about the survey done by eMarketer last June in 2010, and it shows how they pulled a number of online advertisers to gauge their sentiments on how effective paid search has been in terms of their lead generation campaigns. What we found is that paid search, pay-per-click, you see here is at the very top, has overall been most rated, very effective amongst online advertisers, followed by email marketing and natural search results. This is powerful because just in terms of paid search and the reaches you have in terms of online marketing with Google and places like Yahoo, there are people online again looking for this information, and pay-per-click is offers you dynamic amount of options out there in terms of how you can target these users that are online, and we'll talk about those in just a second. Next, I wanted to show you a chart. This is Google-specific information on hospital-related queries, and they are in fact growing. Since 2008, we've seen substantial year-over-year growth with online hospital search queries, and in fact, we do see a peak in April through May, which is coming up very soon. So one, I encourage all of you to consider when you're thinking about your strategy for your lead generation campaign, to look online and consider the market and that's growing there. And then two, I just wanted to point out that now is a great time to take advantage of the lift in traffic in terms of how many people you can reach to grow your business. The next slide I have here relates directly to urgent care related searches, and as you can see, there's really strong year-over-year growth here as well. It's up almost triple from December of 2007. And this goes to show just the growing market, in the healthcare and health-related space in terms of online search queries and what people are online looking for these days. Next, I wanted to take a little bit of time to talk to you about the display network. Now, while Google search, the Google.com page, has almost over 5 billion users search queries each day, people are only spending about 5% of their time on the Google search page. And so the 95% of their time is spent surfing our partner sites on the Google Display Network. So many people, are wondering what exactly what advertising vehicles are available on the Google Display Network, and there are a couple of different things that you can use and take advantage of when advertising there. One would be text ads, which are very easy to implement, although they're less compelling. Text ads are what you normally see when you go on the Google search page, and they're also available for your use on the Google Display Network. And next we have image ads, which take some additional effort, but are typically what we find to be more engaging and more powerful in building a brand. And although people are spending about 95% of their time on Google Display Network, that means that the reach is expansive. And the keys to success in developing a successful lead generation campaign is targeting the right market. And we've now got great tools that you can use to target the market that best fits your needs. We have the capabilities to target demographically on categories and interests, as well as targeting specific sites. Our placement targeting tool, which enables you to either build campaigns based on keywords for the content that you'd like to target. In addition to that, you can actually choose specific websites that you'd like your ads to show on and manage your bidding strategy and advertising strategy from that perspective. Next, I wanted to take a little bit of time to talk to you a little bit about Google Ad Planner, which is a free research and media planning tool that has helped many of our advertisers construct and build their strategy for their Google Display Network targeting for lead gen campaigns. This tool allows you to simply define your audience by the geography, their demographic. You can target down to which websites they visit, the keywords they search for, and you can identify which sites they're most likely to visit as well. Next is the layout of what the page looks like, and we can sort of go through this a little bit. But what you can do here is you can filter the results through various site filters with, that are here available for use on the site, including which websites that only have ads that belong to certain site categories or have specific ad specs. You also have the ability to discover individual site details, such as the number of unique users that visit the site each day, the site's reach, the engagement metrics, page views, and you can even track down to see which keywords a particular user has searched for that has led them to visit a particular site. Next, I wanted to talk to you a little bit how you can track the success of a lead gen campaign using Google AdWords. We have a great tool called Google Analytics, which is also free and allows you to really zero in and track down user behavior. This tool is very powerful because it monitors how users navigate your site. You can see all the way down to how much time a particular user is spending on each page of your site, and you can track user behaviors from which keyword types, which keywords they're typing in, to which ads they're clicking on that are taking them to specific landing pages on your site, and you can track all the way down to whether or not they have made a conversion. The information that you can gather from using Google Analytics is powerful in that you'll be able to find which things are working for you in terms of keywords, ad copies, and just overall your advertising strategy to find out what is leading to the most successful conversions in terms of generating leads for you and your business. Next, I wanted to take a little bit of time to share with you a case study or success story with 1-800-DENTIST. So 1-800-DENTIST is arguably one of the most powerful or most well-known brands in the dentist industry today. And they've used Google AdWords to help them establish this brand. At the time, when they were deciding whether or not they needed to use Google AdWords, they needed a couple of things. One, they were looking to grow their referral customer base. They wanted to refine their messaging on what products and services they were delivering, and they also needed to measure the effectiveness of their advertising. So they started with Google AdWords in 2002, and they tested a number of different features and ad formats to best support their goals. And they were able to use Google AdWords to increase their click-through rates, refine their marketing, and develop more qualified leads. And next, I will hand this back off to Jessica, and we'll start talking about digital lead generation best practices.
Thank you, Isaiah. So let's get started here. All that great information, we wanted to share with you now how to really use these best practices to begin your search marketing campaign. So first, we want to talk about setting your objective and really defining your target audience. So I know from the poll that some of you said that you don't really know how to reach the target audience. So first, identifying that, and hopefully some of that research we shared with you today can help you really clearly figure out maybe what kind of site they go to, what kind of keywords they're searching for. So two, create an integrated digital marketing strategy. Third, create a search campaign strategy. 4, have a post-click strategy, define results and measure ROI, and finally, continuously testing and optimizing. So let's go through this. Number 1, defining your objective and your target audience. To start off, we really want people to start thinking about what their goals are. So thinking about what your sales is doing, your sales department, how are they generating leads right now? What is the process from inquiry to leads to sales, and what is that conversion rate? And what you're doing offline can really help inform what can happen online. And really starting out by maybe testing a couple of months to see how online lead generation compares to your offline lead generation efforts. Really understanding how that pipeline works. So again, going back to that graphic of our acquisition funnel, identifying where your target audience is and which stage will be really important on choosing the right marketing tool. So thinking about how many leads per month you're looking forward to, how many sales you're looking to make, and that can really help you define your marketing budget. So hopefully those previous slides gave you a little more insight on your target audience, but we want to make sure that there's additional research done before you begin to understand the gender, the family influences, education level, what types of sites they visit, what do they search for, how do they use the internet, and this will really influence the design of your website, the photography that's used, the content, the forms, and ultimately that media buy. So Isaiah introduced some great tools that allow you to search for this type of information, and agencies also have great tools that we use to really understand that demographic makeup on a website, and we'll know where to target them based off of that demographic insight. And again, these are some of the tools available to allow you to begin some of that research for free. These are tools online offered by Google. The search keyword tool allows you to really understand the volume of searches, both locally and internationally. That way you'll know where you want to target and what kind of keywords may work for you. Again, it's different for every person, every institution, because your service offerings are different, and based off of how you structure your campaign, that actually really impacts your cost per click. I think Isaiah touched upon this. Using Google's double-click ad planner, you're able to define your audience, find those relevant sites, and really start building and analyzing your media plan.
Great. And I wanted to take some time to talk to you about how to create an integrated digital marketing strategy. So the first thing you need to be considering is how to identify and segment your audience so that you can be most relevant in terms of how you're building out your keyword list when you're doing a search campaign, and also when you're thinking about advertising on display, you also want to keep in mind what content it is you're targeting online. And these strategies are really no different than what you'd be doing had you been doing traditional communication, so it's best to combine the two when you're thinking about your overall digital marketing strategy. The second thing is your messaging. I think you want to be very clear in terms of what products it is that you offer, and then what do you want your users to do when they visit your website. This is all very important when you're determining what your calls to action are going to be, because it gives the user incentive and a clear idea of what it is that you offer and what it is they need to do to take advantage of the things that you're offering on your site in terms of whether or not they're filling out a lead form or purchasing a product. And then to wrap everything all together, the most, I think, in terms of being effective in generating leads is having landing pages that are relevant and easy to convert on. So, for instance, if what we found to be most effective landing pages are landing pages where the information on the page is directly tied to the keywords and the ad copy that our advertisers have built out. And then to take it a step beyond, lead forms on landing pages are very effective because the call to action is right there as opposed to maybe being hidden 2 or 3 clicks past the landing page. And then here's a little bit about the digital marketing strategy. Just wanted to give you an idea of what all goes into generating qualified leads. As I mentioned a little bit earlier, just touching on the research piece, this kind of goes back to identifying and segmenting your audience, really getting to know exactly who it is that you'd like to be filling out your lead forms or taking advantage of your products. Then once you've identified them, building your strategy around what it is that they're looking for so that you can best target them. You want to keep in mind your digital marketing mix and make sure that you're offering a consistent and relevant web experience. A lot of times when we see campaigns that are not performing as well as they possibly could be, it's because the advertiser has not made a very clear link between the landing pages, ad copy, and keyword lists that they've built out. Everything should be cohesive and consistent and relevant. It's going to be very effective. Web analytics is also key in terms of generating qualified leads. Again, I touched a little bit on using Google Analytics earlier and some of the metrics and information that you can pull from that. One thing that's great, as I mentioned earlier, is being able to track a user from the keywords that they're searching for on the Google search page, right down to which ad they're clicking on, which landing page they're going to, how much time they're spending on these landing pages and filling out lead forms, and then on the back end, tracking whether or not they're converting for you. That's going to be really powerful because then beyond what you can see in the Google AdWords interface in terms of seeing what your cost per acquisitions are and click-through rates and conversion rates, you can really see the individual behavior and what the most successful conversion paths are. The next, to keep in mind is, just your return on your investment. You want to make sure that the amount of money that you're spending on online advertising makes sense for your business, and whether or not it makes sense, and whether or not each conversion is worth it. So you want to make sure you're modifying your strategy with money in mind. And the next step and last step is optimization, which kind of ties back into research. Just pulling all of these things back together, making a strong analysis on it, and using it to make your lead generation campaign better. And next, I will talk a little bit about creating a campaign strategy. So paid search. If you're familiar with the Google.com homepage, that is the core of the search campaign. And so this is where advertisements are bought on a cost per click basis in an auction system, and their ads are triggered based on the types of keywords that you have built out in your list. So the first thing to keep in mind would be relevance. Relevance is very, very, very key in terms of building out a successful Google search campaign. I tell advertisers all the time, you want to make sure that when you're building out a particular campaign, when you're organizing your ad groups, you want to keep your keywords organized in close, tight themes. So you wouldn't want to have a keyword list built out where you've got different sort of conditions built into one particular group of keywords for an ad group. You want to break them out. So, for instance, maybe having cancer keywords in one ad group versus having heart condition keywords in another, and so on and so forth. But the key here is to make sure that your keyword lists are directly relevant to the ad text that you have linked to these particular keywords. So when a user types in search queries, that particular keywords they're searching for are going to trigger your ads essentially. And you want those all to be relevant to each other and be relevant to the landing pages and content that the user will essentially be looking at. And then the next thing to keep in mind is we touched a little bit on making sure that your keyword lists are targeted and relevant, but then also you want to make sure that you're flexible. Your campaigns can be optimized on a daily basis, so don't be under the impression that it's a set it and forget it kind of situation, but really you want to make sure that you're monitoring closely the performance each day and making adjustments over time to really refine the type of traffic that you're generating and how much money you're spending and really tracking your ROI. And I will pass it off to Jessica to talk a little bit about having a post-click strategy.
Great. Thank you, Isaiah. So having a post-click strategy, what this essentially means is what happens after someone clicks on your ad. So Isaiah touched upon having relevant content on your website is extremely important. So we say here that, I think we said relevance probably 50 times here. That's because it really impacts that cost per click. I think we didn't dive too much into the quality score, but that's actually a way that Google calculates whether or not your keyword is relevant to your ad and also to your website. And that quality score helps you determine how much you're going to pay for that keyword. So that's really important when you're competing with a lot of people in that same space bidding on the same keyword. So in terms of that post-click strategy, landing pages and microsites, you want to define what your key performance indicators are, meaning what are you looking for it to be a successful campaign for you, whether or not are they spending a lot of time on your website, are they browsing through many of your pages, or maybe they're filling out for it and really turning it into a conversion. So content development for the web is important because you want to make sure you guide the user in their experience on what to do next, whether it's click on, about us, or maybe directly making an appointment. So making sure that's very tailored to the audience. So we talked a lot about lead generation landing pages and microsites, so we realized that maybe some of you don't know how to differentiate it yet. So lead generation landing page is essentially a single page website for prospective patients to arrive at after clicking on a link. And what does it do? It considers the visitor's geographic location, what the search keyword preferences are. It really provides a segmented and really highly targeted message for the visitor because it's only one page and there's a limited amount of real estate to put content on there. And it presents kind of that introductory level of information to help them ask more information. So a lot of times you'll see websites that have a lead generation form or a contact us form for them to get more information where you can either call them or send them additional mail material. And when should they be used? They should definitely be used when it's a very specific transaction, whether it's inquiries, referrals, new patient registrations, or even newsletter signups. And if the target audience is only needs a brief introductory information to convert. We call them the delegator persona. That's someone who's really just doing that initial research and wants to contact you or have you contact them to learn more. And that target audience, that's early in their decision-making process. And also, a landing page is great when you have a tight timeline and you really want to get started on testing and understanding your keyword search trends and how much things might cost. And you don't have enough time to convert your existing site or your microsite into this lead generation machine. So it's also useful when it's supported by traffic generating campaign, meaning you have campaigns that drive traffic to the page. That way you can really measure performance. And lead generation microsites, think of this as a mini website. So a smaller version of your website, and this is often created when your website, again, isn't enough for marketing purposes. Maybe call to actions aren't as clear. Maybe your tech department takes a long time to implement changes. Oftentimes, agencies will suggest creating this microsite in the interim, or even for the long term, for you to use it as a tool for testing your online marketing campaigns. So again, as similar to a landing page, it considers the visitor's geographic location, search keyword preference, and it has very segmented and highly targeted messages for the visitor, along with very relevant informational and reference content. And of course, providing that clear call to action to submit a form or call a phone number. And when they should be used, similarly for when it's a specific transaction, and also if the target audience is further along their decision-making process, they know they want to make an appointment now. It's composed of meaningful subsegments, meaning your website has multiple pages that gives them a lot more information. It requires moderately in-depth info to really convert that researcher persona. Someone who needs a lot more information to convince them that this is the right institution to go to, this is the right hospital, or right doctor that they want to see. So it requires, more effort, more complex interactive brand experiences, such as including videos or virtual tours. And I mean, it operates so similarly to your regular website, except the goal is lead generation, so information is concise and to the point. And this is an example of how everything's working together for one of our clients when someone's looking for a recovery center specifically for alcohol or drug rehabilitation. We have an ad here that's display for St. Helena Recovery Center. So our client's ad is display. We even have a phone number included so people can call directly with that number without even clicking on the ad. And then if they do click on the ad, they're brought to a very relevant site experience introducing what the Recovery Center is about. And the user can click for more information or call, or they can browse on the top navigation to browse through the web pages if they need more information to convert. And passing it off to Isaiah to talk about results and measuring ROI.
Great, thanks, Jessica. So there are a couple things that I wanted to brush on when we're thinking about how we are going to be defining the results and measuring your ROI. I think one of the biggest things is making sure your online measurements are transparent. You want to be setting the right types of goals and identifying the right metrics to be tracking when you're judging the success of your campaign performance. There are a lot of different ways you can do this. You can be thinking about what your cost per clicks are for your keywords, or what your cost per acquisition is. How much money are you spending on your advertising for every conversion that you're getting? Click-through rates are also a great way to think about how relevant your ads are. That's just basically the number of times people click on your ads over the number of times your ads are showing. Typically, when we see higher click-through rates, that means that your ads are more relevant to what users are looking for. But to take it a step beyond that, using tools like Google Analytics really gets granular with that in terms of seeing that once they've clicked on the ad, where are they going on the website? Are they filling out the lead forms? And then other metrics that we find that some clients use are looking at ad ranks and impressions to sort of gauge how well and how often your ads are showing. This is something that we typically see with clients who are more engaged in more branding types of campaigns, where the focus is not on generating leads or making conversions, but more or less on really just establishing a strong brand and getting in front of the users. The next thing I would say is that you're definitely going to want to make sure that we kind of touched on these metrics already, but cost in terms of identifying your total spend, and then impressions is the number of times your ads are showing, and clicks. We talked a little bit about click-throughs. This is a great way to measure, again, the relevance of your ads. But then conversions, is interesting in that, when you're using things like analytics, as I mentioned earlier, you can really get granular and see exactly how users are behaving online. One thing is I also think would be really interesting in terms of defining your results is integrating both, the metric that you're using for, or integrating the ways you're tracking success on both your traditional media strategy as well as your digital media strategy. Some tools that we have available here at Google in terms of tracking the performance is using unique website URLs when you're tracking the success of whether or not people, to track the traffic that you're getting when people are clicking on your ads, or using unique phone numbers when you're advertising online. That way you can peg this against how well maybe other mediums that you're using for advertising are doing versus the results you're driving online. This next slide shows is just a poll in terms of what most advertisers are using in terms of how they're judging their success. Again, like I mentioned, click-through rates are great to determine relevance, but it's also followed by lead generation and response rates, incremental sales, and return on investment. So these are, this is a great tool right here, a great survey to take a look at when you're thinking about how you're going to be tracking the performance of your lead generation campaign. And next, we have we're defining your results and measuring your ROI using web analytics and ROI optimization. We have a couple of different definitions here for you. So one, defining the value of each lead. This again is what we define as a cost per acquisition or cost per conversion. taking the value of the patient, multiplying it by the number of patients that you're having, and then dividing it by the number of leads that you're getting. This will give you a clear idea of what your lead to conversion rate is, and then how much money you're spending on that. Next, lead values can be then related to online marketing through web analytics. Again, just talking a little bit about analytics and how you can utilize this to really track down to see where online users are making the best use of your site, and determining which strategies are working best, so that way when you're planning and setting aside budget for the future, you do so effectively. And optimizing poor performing campaigns based on lead value and ROI. Again, just sort of making the assessment of whether or not the amount of money you're spending on your online advertising campaign is worth each conversion, and taking a step back and maybe making adjustments to your cost per click strategy, and in the case of doing display targeting, monitoring which sites are performing best for you, which online content works well, is typically what we find to be helpful in terms of making adjustments to your online marketing strategy.
Okay, great. So getting to our last point here, continuous testing and optimization. So making sure that after you set all this up, you want to make sure you get great results. So that landing page microsite experience is really important. So we aren't going to dive too much into this because we're kind of running out of time, but A/B testing is something that you can implement on your website to really test, different ad copies, different headlines that might work, different offers maybe, different hero images. So you see the graphic here that there's a lot of variations that you test to make sure your website is working the way you want it to work. So that's how multivariate testing works, by testing multiple components on your website. And talking about a little bit about search engine optimization, this is something that goes hand in hand with search engine marketing, with pay-per-click ads. You want to make sure that your website is developed correctly. So a lot of times we see that hospitals want to save some money, and they put up a quick site, but not really understanding what goes on the back end. So the back end meaning the code, how the site is programmed is extremely important, how it's set up so that it's a easily read and digestive site for search engines. That includes your meta description, your keywords, making sure your content's relevant so that Google or Yahoo, MSN will rank you higher on that organic search page. And the organic search results are non-paid results. And this happens organically, naturally, based off of how your site is optimized. So making sure you have the right linking structure, anchor text, just making sure you follow best practices for web design and development. Okay, and we wanted to share really quick a case study on St. Helena Recovery Center. I know we mentioned this example a couple times on our presentation here. So we want to show you how the website kind of looked like and what it was doing before we, our EMG, our agency, would try to optimize it. So a little background on St. Helena Hospital. It's a nonprofit organization, part of Adventist Health. And they really have a number of services ranging for acute care, behavioral health, and wellness programs that draw them to that San Francisco Bay Area. And what they needed was they wanted to increase self-referrals online for multiple programs, and that included the recovery center. And they needed to generate awareness to really promote their brand, St. Helena, and also promote their doctors and their services. And also, of course, it's really important for everyone to really be able to track that, track the success. So what we did was, you can see from this image to this more colorful image here, is we optimized the site not just based on design, but also on content. We wanted to make sure that the content had relevant messaging to people, what people were searching for. We included this top-level navigation that really summarized what people were looking for based off of the analytics we found from the previous site. And we added this form here that actually expanded when you clicked on it, so it wasn't so intrusive. And this form was actually placed throughout the website. And this is some best practice that we'll really recommend. So there was an extensive site audit. We developed a lead generation microsite. We also actually created landing pages that target specific drug or alcohol recovery. And we created both desktop search and mobile marketing campaigns. So we actually created a mobile landing page I'm going to show you in a bit that had the same look and feel, but really targeted mobile users because we saw a huge increase from August of last year to this year on really the percentage of people visiting the website from mobile browsers. And we also implemented call tracking to track the phone calls and keywords for additional analytics. So this is an example of how a mobile page might look like. Really clear call to action with click to call a client services advisor, so that if they're someone who's already done a lot of research and just want to make an appointment, this is a perfect way to do so. Or they can visit the full site from their mobile browser and fully compatible. So this whole experience will display on their mobile phone. And what we found was we delivered over 5,000 increase in 2010. It's a huge increase for what they were getting previously. And this is solely from online. And we really decreased our cost per inquiry from the beginning of 2010 to the end. And I can't reveal the exact cost, but we decreased it by over 89%. Meaning initially, their keywords really cost a lot because their quality score was a little lower because it was the first time entering the space. But through time, we really managed to decrease that cost per inquiry. And their average leads to sales conversion rate is nearly about 30%, which is a lot better than what they were doing before. And online has really proven to be a great method. So they're investing a lot more marketing dollars into their online marketing campaigns now. So there's been over 14,900% increase in phone inquiries compared to the beginning of 2010. So what we've seen with the medical community was that people are really looking for information. They want to talk to someone live to get more information rather than fill out a form. Filling out a form might work better for someone who's just doing some initial research, but a lot of times it's very urgent, especially if they have a specific condition that needs immediate treatment. So adding that phone number here has been really great for us, and we're tracking this phone number, meaning it works the same way as a text ad where we know exactly what keyword drives them to complete a form. We know here exactly what keyword drives them to make that phone call. So we are continuously optimizing. Okay, sorry to really speed through this. I realize we're kind of over our time limit, but so for our landing page evaluation, this is the part where I think a lot of people have been waiting for. We picked out of our list of attendees randomly Memorial Health System of East Texas. So what we looked at was actually from our list of attendees who submitted the URLs, their websites, many of you guys actually don't have a landing page or a microsite set up. And understandably, I think that's because many haven't gotten started in the search space yet. We have here an example. When we looked at their website, we saw that it was a very lengthy website. This is a screenshot of it. I can't include it in the slide exactly, but you see here that we really recommend to minimize that scrolling because it's important to really keep the information above the fold. And if those who are familiar with kind of web design, the term above the fold means that it's above the screen resolution of your visitors. So all this information in red here is scrolling below what they can see immediately when they land on the site, meaning they have to scroll all the way down to find this information. And also we realized that the site's designed in a way where it's not maximizing their screen resolution. So this is a stat here based off of many of the visitors we're seeing going through our website. The majority of screen resolution is now 1280 by 800, followed by 1024 by 768, meaning there's a lot more real estate nowadays compared to the olden days where websites were developed for smaller monitors. Now people have dual monitors, and they really have an enhanced browsing experience. And then we also noticed that the website, like many of the sites we've seen, don't have a clear call to action. All their navigation items kind of look the same, and it's great that there's a top level navigation, so there's multiple levels, but we want to make sure that people know what to do. We did notice something great here is that there's a ability for them to convert this site into Spanish, so that's great. But I think that if you identify maybe finding a physician as your main call to action, you want to distinguish them maybe with a different color button. And here also we noticed that it's great that they included their social networks. As we said, that going on social networks to find health information is an increasing trend. So we want to make sure that this is displayed. But also a suggestion is maybe having it more integrated on your website, such as integrated Facebook social plugins, such as a like button. And that allows people to like the page with just one click without ever leaving your website. It makes it really easy for people who are already logged into their Facebook. And same thing with Twitter. You can actually integrate a Twitter feed here so everything's displayed live. Rather than taking them away from your site experience, you might want to keep them on your website. And we want to make sure that this hospital really showcases important information. These are all kind of screenshots of the information we found on their homepage that took a lot of scrolling to get to, but this is really great information. Patient videos, testimonials, latest news, awards and recognition. This is all great information that hopefully can be displayed above the fold, and these types of information could be creatively displayed if the website resolution was maximized. And lastly, we want to make sure you improve your site overall for lead generation. If you are considering driving paid traffic to your website, if your website is not equipped with maybe a lead generation form or it's just not meant for marketing, then you might want to consider creating a landing page or a microsite in the interim. But we want to make sure you really add a contact us page for general feedback. We didn't really notice that on this website. Adding a form across your site, like what we did with St. Helena Recovery Center, really increased their conversion rates because it was easy for people to ask a question at any time. And also adding a phone number. I know some of you may not have a call center, but consider maybe how are questions being answered right now. If they're looking to make an appointment, maybe directing you to your sales department. Those are all great options. And there's also options to hire on a call center if you don't have one. So now we're getting to our key takeaways.
Great. So the first couple key takeaways I wanted to touch on is that, one, people are spending more time online finding health information, specifically searching on search engines for symptoms, treatment, and disease condition-related information. Please don't leave here without realizing that there is a market online in terms of there being people looking for health-related and hospital-related search queries. We behoove you to take advantage of that. I think that the market is growing a great deal, and now is the time to really consider taking advantage of that. And then Google AdWords and analytics are great tools that allow you to track and measure your online lead generation performance.
Okay, and third point, I think this is a point where everyone knows already, relevance is key, making sure everything works together so that it's valuable for your target audience. And the fourth point is, I know there's a lot of information, so considering maybe working with a strategic partner to get you start planning might be a good idea, or even just asking some questions. EMG is here for any questions you guys want to ask for the webinar, or even call us if you had additional questions that's outside of what we covered today. But really, working with someone who's knowledgeable can really help you maximize your time on continuously testing, optimizing performance, also identifying some of those KPIs for you.
Awesome. Well, thanks so much, Jessica and Isaiah. Definitely a lot of great information there, lots to digest. So a lot of statistics and numbers. So definitely make sure that you check out the presentation once we post it on our website and on our SlideShare so that you'll be able to share that with other people that you work with, and you'll be able to get a really good understanding of all the data that we kind of presented today. So we had a lot of great questions coming through as the webinar was going. Most of them we already addressed in the content, so that was good. That's always a positive note. We did have one extra question that we'll address real quick, and then I know we're a little over on time, so we'll get through this question and then we'll wrap things up real quick. A couple people wanted to know about usability testing and what parts of different websites, of our different landing pages and microsites you do usability testing for, and kind of how in depth that you want to go into with something like that.
Okay, I can answer that. I noticed that someone was asking specifically with St. Helena. Yes, we did do usability testing, and we were also looking at analytics. We can't share exactly all the variations we tested, but it's good to know that we did spend time testing different creative, and we're going to continuously test because it's an ongoing process and we need a larger data sample. And the new website actually just launched this past December, so we're waiting on more data for that. But I highly encourage using different testing because, many people, including us, people give you different best practices recommendations, and you want to see if that works for your audience.
Great. Well, thank you so much again to everyone for sticking with us for a couple extra minutes here to finish up. we really hope you enjoyed the presentation of this and that this information is going to help you guys moving forward in your lead generation tactics and marketing efforts. So again, you can see on your screen where you're going to be able to find the presentation when it's done, and also feel free to follow us on Twitter and Facebook so you know about our upcoming webinars and presentations and case studies and all that good stuff. If you have any other questions for us that we can answer for you offline, feel free to shoot us an email or let us know on our website. So thanks again. Have a great day, everyone, and we'll see you all soon.
Thank you.
Take care.